Hello and welcome to Mission in Focus. In this webinar, we'll be talking about a subject some of us find quite challenging, the role of ethics in Catholic health and aged care. To hopefully bring some clarity for you, we'll be talking about the foundational principles of Catholic ethics, the intersection of personal and professional ethics, and how ethics relate to the provision of health and aged care in Catholic facilities. Dan, a lot of people find ethics a bit daunting, and particularly ethics in Catholic health and aged care they might find daunting. Can you distill what some of the foundational principles of ethics are?
Ethics certainly doesn't have the best reputation as a discipline. Catholic ethics especially so, I think. I often joke with people it's a great way to assure silence on the plane if I'm sitting next to someone to tell them I'm a Catholic ethicist, because normally they don't want to talk to me after that. I think what's being responded to in a context like that, and when we feel fear when we discuss Catholic ethics, is probably a caricature, or definitely a caricature of the discipline. It probably means that those who are responding like that don't understand the discipline well, or perhaps that those who have communicated it to them in the past haven't done so in a way that really deals with the responsibility of communicating a beautiful ethical vision well. If Catholic ethics is communicated well, any person of goodwill can see that it's a beautiful, truthful, and good ethical vision, and it should resonate with their conscience. That's part of our theology. Doesn't mean it's always going to be easy to communicate the Catholic ethical vision, but it must resonate, because that's what we say is true about the ethical vision, that it speaks to the truth of what it means to be human in the most beautiful way to be human. These are words that often when you hear Catholic ethics, you don't hear them bandied about. You don't hear beauty much. Sometimes you hear goodness. You don't hear truth that much. But these are three great principles which are part and parcel of the Catholic ethical tradition. The best way into it is through an imaginative exercise. What I often ask people to do is think in their mind of someone who they think they hold as sacred in their life. It might be a child, it might be a brother or sister, it might be a parent, it might be a best friend, it might be a spouse, whoever. Imagine that person's face in your mind and think about, since you think they're so wonderful and sacred, how do you respond to them? What kind of person are you in their presence? What kind of decisions do you make in their presence? And then imagine if you believed that every person on the planet had that same sacredness, that every person in the future is going to have that same sacredness, that every person in the past has had that same sacredness. What kind of an organisation would you create? How would you deal with people who clearly haven't been treated as if they are sacred? How would you think about your organisational decisions when you're performance managing someone? What kind of procedures would you do within the context of your healthcare organisation? How would you care for your patients? How would you treat all of your family? And so on and so forth. Once you start imagining in that way, you've reached the heart of the Catholic ethical tradition. The fundamental principle which sits at the heart of all Catholic ethics is that all persons have an inherent dignity, a sacredness which cannot be taken away, which is given to them by a gift of God, and not based on any other qualification, not based on social status, not based on gender, sexuality, ethnicity, religion, any qualification. You're sacred because you're human. And when you start thinking about that, that's a profoundly countercultural message. the people who come and work in our organisations often do so because that countercultural message resonates with them. That draws together two great traditions. One is the Judeo-Christian tradition, and the other is the Greek philosophical tradition. And in the Judeo-Christian tradition, it's captured in the 10th chapter of the Gospel of John, and many other places in our sacred scriptures and tradition thereafter too, but synthesised really beautifully in the 10th chapter of the Gospel of John, where Jesus says, "I have come that you may have life to the fullest. You have dignity, you're sacred, I have come that you may have life to the fullest." In the Greek tradition, we find it in Aristotle. What's the purpose of being human? The purpose is to flourish. Happiness in the broader sense of the word, not as the cheap happiness we get from day to day, but happiness in the sense of a life well lived, a life lived in the most excellent way. Within the Christian tradition, that invites us to ask very serious questions about who can't flourish, who can't live life to the fullest in our current context, and by what are we measuring? Turn on TV for half an hour in the afternoon, you'd expect to believe that life to the fullest means a lot of possessions, material success, feeling great every day, and so on. Again, the Christian tradition tells us something different. It's a much more comprehensive vision of what life to the fullest means. It's a life of good relationship. It's a life of service, of giving out more than taking in. And it's a life ultimately that finds its home in the context of a relationship with a God who loves us. That again is a countercultural vision. And those are the other principles which sit at the heart of Catholic ethics.
Dan, is the vision you sometimes hear on the aeroplane about what Catholic hospitals can't do because of ethics?
It is, absolutely, and that's probably one of the mistakes we've made as a PR exercise, is to go out and tell everybody we can't do this and we can't do that, without situating the can'ts in the context of the bigger vision of which we're a part. And of course there are things that we can't do if we're serious about our moral vision. Like if we really truly believe that each and every person is sacred and has dignity, it automatically paints some lines on the field that we can't cross. Some of these lines are very, very obvious. We should never abuse people. And for goodness sake, the Church itself has shot itself in the foot with this awful crisis that we're currently working our way through, and God help us, hopefully setting up a better situation for the future where such abuse should never happen within the context of our ethical vision. Because that's very clearly a line that if we truly believe that every person's sacred, we must never treat someone in an abusive way. And there are other lines too in the context of this story. It gives us a positive vision of what we must do for each and every person that comes in the door. But it also tells us we should never intentionally and directly kill an innocent person. We're currently going through the big debate about physician-assisted suicide and euthanasia in the context of healthcare in Australia. And one of the things our ethical vision tells us is that it's never okay to directly and intentionally kill an innocent person. Why? Precisely because we've painted this direction for our ethics. That if you're sacred, that if you have a dignity, then it's never okay for me to kill you. That doesn't mean that our current methods of care for those who are suffering in tremendous pain are the best. It doesn't mean that we can't do better for caring for those people. But it does mean that we don't solve the problems that we have in end-of-life care at the moment by crossing that line, that indelible line in the sand for us.
Dan, what do you see as some of the ethical challenges for the future?
A few of the biggest ones, I think, have to do with the very culture of which we're a part. A culture where the predominant ideology has a theology, it has a God, but it's not the God we believe in Catholic healthcare. It's not the God of the sick and the poor. It's the God of greed, the God who will push for profit making at any cost, and the God who will get rid of those who are poor and vulnerable because they're in the way of that profit making. That is just our normal way of thinking in our context. And one of the great ethical challenges is to realize that and to give ourselves permission to think outside of it and to have the courage to think outside of it and to challenge it. Because if you want to find the genesis of a lot of our health concerns in this context, you can find it there. When we begin to treat people as objects who are there to create wealth and profit, rather than as subjects who we're charged with the task of caring for as sacred, you can find all of your health concerns kind of germinating from that point of view. New technologies are going to throw up all sorts of ethical issues for us. I mean, they're remarkable technologies too, and saying they'll throw up ethical issues doesn't mean that they're not something we should pursue. Because when we talk about ethical issues, we talk about something that can be good, can be done wonderfully, beautifully, truthfully, but also something that can be put towards bad ends. And you only have to look now at what's happening in genomics and all sorts of other areas to start thinking about the ethical issues that arise there. And they're not only issues about procedures themselves, but they're also issues about access to those procedures. Who will the new genomics ultimately help? Will it be everyone? And certainly those who are proponents for it are saying, yes, this is the social revolution in a sense, because it will be available and accessible to all. When we go back to the context in which we do our ethical reasoning at present, we might think critically about those kinds of claims. Not in the sense that we don't want them, because that's certainly the vision that we should have, but is that actually what's going to happen? Who owns this technology? What is their interest in this technology, and so on? So I think those are huge things for us to think about going forward.
Xavier, how do you see the intersection of personal and professional ethics in a Catholic environment?
There's a very strong mission, sense of mission, if you will, a very strong ethos, a very strong sense of this is who we are and this is the way we provide care. And that's not necessarily, well, it definitely isn't a kind of aggressive imposition of one's moral views on others, but rather it's simply this is what the organisation is. And if you take it away, if you take the ethics away from it, it ceases to be what it's supposed to be. That you can't actually conceive of a healthcare provider that was founded on the principles of, for example, a particular order or a particular philanthropic group or something like that, working within the Catholic tradition. And you can't take ethics out of that and expect there to still be the same institution there. It would be to effectively take a core element of the mission away when you do your work in that provider. So I think that's important for Catholic healthcare staff, even if they're not themselves Christians, even if they disagree fundamentally with basic elements of the Christian faith or Christian ethics, and that's perfectly okay. But it's very important to realise that this is a basic part of good professional practice, is that you abide by the standards, the ethical guidelines of a particular employer, of a particular professional body. And unless those guidelines somehow directly conflict with your ethical views on things, unless they're absolutely unreconcilable with your deeply held personal convictions, there should be an openness to learn about those alternative perspectives on ethical issues, to try to understand these different ways of seeing a particular contentious ethical matter. To consider the issue of assisted dying is quite useful in this context, because it's true, there are a variety of reasonable views in the community on the issue of assisted dying. People have very strongly held views, often because they've had personal experiences which have led them to think one way or another about the issue. And that's something which Catholic healthcare providers respect, the personal views of people on particular issues. But understandably, that doesn't mean that there's a certain openness to acting however you want to in these issues. It doesn't mean that you can just act however you want to when you're dealing with patients in a way that's relevant to assisted dying or what have you. There are obviously certain things, certain procedures that Catholic healthcare providers don't provide. Assisted dying is one of them. That's part of the Catholic ethic. It's an ethic of the sanctity of life, but also it's an ethic of hope. And there's an idea that the provision of assisted dying fundamentally undermines that ethic of hope. That's the way the framework works. And therefore it's perfectly reasonable to expect that staff, or to ask staff to try and reflect that ethic in their practice, to try and embody that in the way they deal with patients. Aware that in other contexts, in secular contexts, they may act differently, that's perfectly fine, but only in the context of the organisation, that they form an integral part of the organisation and try and reflect the mission of that organisation in their professional practice. That's what it means to effectively interiorise a professional ethic while at the same time having one's own personal views. I think that people working in the Catholic system shouldn't try and think of ethics or mission as somehow something daunting, abstract, something which they will not be able to come to terms with unless they've worked there for 10 years. I think that in the end, the kind of ethics that we're talking about are the ethics that any decent person should be able to understand, should be able to practice, and practice with distinction. And in that sense, there's a, rather than a need to go and study sort of voluminous textbooks and learn all about specific sort of situations one may find oneself in. That's true, that's really important, but more important is merely trying to provide good patient-centred care in the hospital, in the aged care facility, or whatever environment it is that you're working in, that there's very much a focus on the patient. Because to go back to that foundational principle of Catholic healthcare ethics, the healing mission of Jesus Christ and advancing that mission, well, you need to care for people well, to see people as individuals, as unique, as having an inestimable value. And that's something which, if you can actually reflect that in your practice, you've gone a very long way towards living up to or reflecting the Catholic ethical framework.
Esme, what do you see as some of the big emerging ethical issues for aged care?
I think an issue that is happening more and more so is that aged care, we certainly are a more care-orientated environment than an acute setting. So, the majority of staff would be carers, not registered staff. Yet the acuity in aged care is going higher and higher. We have more dementia, we have more palliative care, we have more comorbidities. And so we're having a situation where we have to provide that care that we want to and should provide with really people that are not necessarily registered staff, but people that are there for the normal care. And how do we educate them, and how do we keep them up to date, and how do we make sure that they are looked after as well in the process, where it's more and more acute, rather than people coming in and just need hygiene and medication and care as such. I would think that we are very privileged being a Catholic organisation, because we have that culture of ethics, of values, of mission, and it shines through, and it gives people the comfort and also the voice to actually raise something where they feel that it is not who and what we are, what we provide. And I think without that, it would be very difficult to provide a service that aligns with the care that we would hope that we actually receive in aged care when we go there, or when one of our loved ones go there. So I think that I'm very blessed to know that we're in an environment where that is the expectation of all the layers in St Vincent's, you know, from the trustees through to the executive, through to the facilities, through to all staff. You know, everyone has that expectation, and will speak and will challenge you if it's not provided.
For more Mission in Focus episodes, visit the Catholic Health Australia website and follow the links on our homepage. I'm Margaret Deeren. Thanks for being part of the conversation.